Welcome everybody. I am Guglielmo Trovato, medical doctor. I am the director of the European Medical Association for Media, E-Learning and E-Medicine. We have the pleasure today of interviewing Dr. Matteo Russo, which is an informatic engineer and an applied mathematician on a topic very important in our view, which is deep learning for healthcare and clinical research. He will display us what is deep learning, and I guess he will show us how deep learning may be or is already a bridge between omics and precision medicine, where precision medicine is based on maths when we think on bioinformatics and computational medicine. So, Matteo, please, can you introduce and speak freely everything you wish? Thanks very much. Go.
Thank you, Professor Trovato. As Professor Trovato has gently introduced, I have graduated from Princeton University recently in informatics and applied mathematics. So today we are talking about deep learning in biomedicine in general. So to introduce everything, what is deep learning? Deep learning can be seen as an emerging technique in artificial intelligence and statistical learning, which has had an enormous variety of application in numerous fields of knowledge, spanning from autonomous driving to medicine, which we're going to talk about today. Today, though, we're not talking about newspapers headlines such as deep learning, a revolution in medicine. Indeed, claims like this are really hard to justify, but we really want to say that deep learning can help us in solving fundamental biomedical problems. And really, deep learning seems to be the best tool to understand what those problems are and what the solution might be. So, again, in order to give a brief introduction, deep learning could be used in diagnosis, prognosis, as well as treatment. This conversation will try to give a very broad and unfortunately not too deep introduction to the use of deep learning in medicine. On one hand, we will discuss about classical deep learning, as in computer vision, reinforcement learning, and natural language processing. And on the other hand, the frontiers of this discipline in medicine with geometric deep learning, a really new technique in the field. Now, it is important to understand that the difference between the applications of deep learning in medicine as compared with other disciplines is that errors are far less tolerated in deep learning when we are talking about medicine, because we're putting the patient's life at risk. Again, if you're using it in another discipline, then errors might be tolerated, and I don't know, a fault tolerance of 10% is fine, but in medicine, a fault tolerance of 1% is already a lot. So we need to be really careful about what precision in deep learning means. So let's start by talking about the most, I would say, like widespread use of deep learning in medicine with computer vision. So the simplest approach that computer vision may have in medicine is the following. We have a set of skin lesion images, for example, from, I don't know, melanomas or mesotheliomas at various levels of resolution. So we might have the initial patch of image or like a microscopic image of the skin lesion. And then coupled with that, we have labels of benign or malignant for previous patients. Now, what the deep learning model wants to do is learning, which is kind of metaphorical, so kind of statistical training on the data set with labels. And for future images of skin lesions of future patients, they want to predict, so the deep learning model wants to predict whether this patient will have melanoma or whether he will not have melanoma. And of course, this applies not only to melanomas, but to any kind of cancer or disease that is dealing with images, and so which can be detected even by an expert only through images or only through kind of a detection of something that is not usual on the skin or on other parts of the body. Of course, the same techniques can be applied to degenerative diseases, neurodegenerative diseases, or many others. Of course, this is the simplest approach because we're kind of getting in images and spitting out labels, whether it's benign or a malignant tumor, or whether it's going to evolve into a benign tumor or malignant tumor is nothing. But of course, using this kind of neural network as a black box could be fine in fields where consequences of a wrong output prediction do not mind the life of a patient, as we mentioned before. In medicine, this is not the case. We need to understand what is going on inside the black box, as well as we need to have a more precise understanding of what the lesion images with a corresponding label of either benign or malignant really mean. So there are very many approaches to this kind of understanding of what the black box is doing on the images and why it is predicting benign or malignant or some other kind of task. One approach is segmentation. The segmentation of the images is, of course, a technique used usually in autonomous driving, where for the car is kind of segmenting with its camera the various pieces of the image or the video they are kind of recording. For example, this is a traffic light, this is another car. In the case of medicine, segmentation may mean this part of the image corresponds to the malignant part, this part is simply skin, this part is something else. And this is about segmentation, but of course we want to even have an interpretation of what the prediction was. So for example, if a particular patch of image is predicted to be malignant, then we want to understand what pixels of this image kind of drove the prediction of the neural network to say this is malignant. And once we have this prediction and we have the pixels as, for example, a heat map over the image where the red part is kind of the malignant part of the image that made the neural network predict malignant, we want to cross-compare and cross-reference with the expert advice. So we want to see whether this prediction kind of is the same as the expert's one, just to understand whether the neural network is performing correctly and how it is performing. And this is kind of the computer vision side and view on deep learning, but there are other approaches of deep learning into medicine. And we're talking about them briefly, and one of them is reinforcement learning. The most, I would say, like seen approach of reinforcement learning into medicine is about like robot-assisted surgery. This kind of lies at the intersection between robotics and statistical learning. The problem here is that basically like a surgeon wants to be assisted in really micro-precise surgery interventions on the patient. But again, reinforcement learning surgery systems do not generalize well to surgical accidents, and thus they cannot be deployed at full scale. They really need to be supervised by someone beforehand. Otherwise, again, the life of a patient may be put at risk. On another side, there is deep learning applied to language, which is called natural language processing, which has a really enormous, even today, application on electronic health records. Basically, NLP, which stands for natural language processing, could be used to query and structure databases on patients' personal data. Raw data are first aggregated from the wild, let's say, and then NLP could interrogate the system by asking what portion, for example, of patients' past history is relevant to the current treatment. They can really ask kind of fundamental question, and querying a database on the patient may really help the physician kind of speed up the process of what is relevant, what is not relevant, what might be done, what might be not done on past history. Again, we have talked about computer vision, reinforcement learning, and natural language processing as applications of deep learning into medicine. And this is somehow the classical spectrum of things. But now, as of, I think, 2019 or 2020, a new field is coming along and is really kind of tackling the problem of submolecular structures. In particular, geometric deep learning, which is a new technique of deep learning, is kind of solving the problem for protein folding. What does that mean? Thus far, we've only talked about classical deep learning models on Euclidean spaces. That is 2D or 3D images that can be thought as a plane or a mesh. Geometric deep learning allows us to deal with data whose nature is not Euclidean at all, without mapping this input dwelling on a general manifold onto a Euclidean space. What I've just said, of course, might sound abstract and really abstruse, but we can think of it as an AI model that learns hard patterns on generally curved surfaces. Again, one might think, what is the application of this kind of things to medicine? Well, in medicine, actually, most of the data is not Euclidean. What we see as images is only a projection of, for example, the skin onto a 2D plane. But when we're talking about proteins, proteins are really curved surfaces that reside on a 3D space, actually on a manifold. So geometric deep learning is used today, as of 2019, to predict protein folding or misfolding. This geometric deep learning system is called MASIF, and it was developed at EPFL. MASIF stands for Molecular Surface Interaction Fingerprinting, which the system disregards kind of the protein internal structure and scans only the external surface in order to understand whether another protein could attach there. So it's kind of predicting what kind of proteins are binding or not binding to that particular side of the protein that you're analyzing at hand. So this is kind of the new frontier of deep learning applied to molecular and submolecular structures and prediction, what we can infer about them through deep learning. But in conclusion, there are various other domains for applications, predicting the effects of DNA mutations on gene splicing, for example, or inferring how important genetic mutations are on drug response. This last one is very important for kind of drug discovery or drug production, which can be tailored on the patient. Hereby, we've only briefly mentioned unsupervised deep learning and generative models, where labels are absent, and the model is, for instance, asked to tailor a drug on patients' characteristics. But in general, we have much more data that is unlabeled rather than data which is labeled. So again, a new frontier of deep learning and machine learning in general is dealing with this kind of data in medical applications, where labels are mostly absent or they're present but in really limited amount. Thank you very much, and I hope you enjoyed.
Thank you, Matteo. May I ask how much the ideas of a researcher are important for going forward in this field of research, but also of application? Is it important, or everything is going easily?
No, I mean, those are just like big umbrellas. The ideas of researchers are really important because this kind of fields, again, we can think about the applications, but it's not that the applications are really working perfectly. When deployed at full scale, even computer vision is not really trusted, because who would really trust to put live patients at risk because a statistical model has given some output? So again, these things are not going smoothly. They're not easy to implement, but they're a good, I would say, starting point for researchers to build upon. So the researchers' idea are definitely much more important than the applications of those. And the new frontiers are really impressive and interesting. But once again, there is somehow a line which is not really sharp between research and patient treatment. And it is important to transfer the right amount from one side to the other. Otherwise, we can really put, I believe, the patient's life at risk if we're not really careful.
Thank you very much. And we will meet each other in a future meeting, I hope.
Yeah.
Have a good day.
Thank
Ciao.
you. Thank you.